prostate cancer is still the second most common cause of cancer death in men. So it's really up to us to try to find the disease early, and select the people who may need treatment and not treat the people who may not. Recently, there's been a lot of press to say, well, should men get screened? Because the fear is that if you get screened and you get diagnosed with prostate cancer, you can potentially be overtreated, which is true. But the flip side is that about 30,000 people will die of prostate cancer this year. PSA screening should be reserved for people who have greater than 10-year life expectancy. So typically in that group, you're looking at men now in about 55 to 70 for the general population. Certainly you have outliers that may be screened earlier because they have strong family history, or if they're African American, or be screened later because they do have a history of family members who live for a long time. About 23 million men are screened per year, of which 1 million will undergo a biopsy and about 250,000 cases will be diagnosed. When people think cancer, a lot of times they think, I need treatment, either surgery, radiation, or chemotherapy. But prostate cancer is not like other cancers. The treatment should be individualized, and that a lot of people may not need treatment. It may be safe to watch them for a long period of time. Treatment options for localized prostate cancer are active surveillance, which is not to forget about the disease, but to kind of watch it to make sure it doesn't progress. For definitive therapy, you're looking at surgery. At Camino Hospital, greater than 80% are done robotically. Then you have radiation therapy, which either can be external beam radiation or prostate brachytherapy. Prostate brachytherapy is putting radioactive seeds into the prostate to cure the cancer. Multiple studies have shown that men tend not to see a doctor until they're ill, right? So the goal of the Men's Health Program is to, one, educate men about their health. So it could be as simple as diet, exercise, or two, identify underlying diseases that they may not even be aware of. The goal should be to prevent things from happening in the first place rather than to treat them once they've happened, because sometimes it is too late. If they come in with some symptoms, for example, urinary, we will make sure that those problems are addressed, and if there are other underlying conditions that may warrant attention, which can be serious, such as diabetes, heart disease, then we will refer them to the appropriate specialist. Everybody's different. Everybody has different goals, and our job is to give people information so that they can take ownership of their own health, and in the end, that's probably the most important thing.